Imagine learning to perform brain surgery without ever touching a real patient. Thanks to virtual reality, that's not science fiction, it's happening right now. Today, we'll explore how VR is changing the game in surgical training, what it gets right, and where it still falls short. But first, what exactly is virtual reality? According to an article titled Ethical, Legal, and Social Implications of Virtual Agents and Virtual Reality in Healthcare, virtual reality is defined as a computer-generated 3D world to be accessed via a head-mounted display, otherwise known as HMD, allowing medical students and professionals to practice procedures in realistic 3D environments, replicating the human body, down to organs, arteries, and even surgical tools. According to Encyclopedia Britannica, this technology creates a realistic experience using interactive devices like goggles, headsets, gloves, or bodysuits. When a user wears a helmet with a screen, they see animated images of a virtual world. The feeling of being there is created by motion sensors that track the user's movements and adjust the view on the screen in real time, while some systems have gloves that use data to replicate touch through force feedback technology. There are many advantages to this technology, with studies showing that VR surgical training improves performance. One study found that VR-trained students made fewer errors and were less likely to injure patients. Another concluded that VR boosts learning outcomes while reducing the logistical challenges of traditional training, like manpower, space, time, and cost. VR surgical training is also completely risk-free and completely safe. Students can practice without endangering patients, making mistakes safely to learn from them. This freedom to experiment enhances learning and boosts confidence in real-life situations. Additionally, the realistic 3D visuals help build a highly immersive experience, allowing students to interact with their environment in a way that mimics actual surgical procedures. This helps develop essential skills like critical thinking, hand-eye coordination, and procedural memory. VR also allows standardized training. Everyone has access to the same high-quality training content, which levels the playing field. And best of all, VR training platforms offer convenience and instant feedback. Students can practice nearly at any time without having to reserve operating rooms and equipment. It is also a game changer for skill development, as the system can grade their performance in real time, providing immediate insights into what they did well and what needs improvement. However, it's important to acknowledge some limitations and ethical concerns that healthcare professionals are looking to improve upon as technology advances. One challenge is the lack of tactile feedback. VR cannot fully replicate the feeling of cutting or stitching real tissue. Also, glitches or bugs can interrupt learning. Additionally, some users face a steep learning curve, especially older adults who may be less familiar with the technology. There's also the risk of misinforming patients about VR's effectiveness and creating unrealistic expectations. The biggest challenge is cost. VR systems can be expensive, which means only well-funded institutions can afford them, creating disparities in access to training. This could exacerbate health inequalities, leaving less privileged groups behind. Some of these issues may be solved with time. Developers are already working on haptic devices like gloves and suits to simulate touch and resistance. Software bugs will likely decrease as the technology matures, and training programs can better prepare users to manage the learning curve. Funding from governments or organizations could also make VR more accessible to underfunded institutions, ensuring that all students and trainees can benefit. It is important to keep these solutions in mind as we move forward with this progressive technology. By making these improvements, we can ensure VR reaches its full potential as a safe, fair, and effective tool. There are many benefits students can gain from this risk-free training, and we should look forward to the advancements to come that will only expand our knowledge and capabilities in surgical training. VR can help create a future of prepared and reliable surgeons and ultimately save lives. And it isn't replacing real-life training, it's enhancing it in powerful ways. The future of surgery might just begin, not with a scalpel, but with a headset.